Our founder, Susan Weiner, lost her son after a 13-year battle with childhood cancer. The Childrens-Cause-For-Cancer-Advocacy was founded in 1999 to give families a bold and responsible voice in national discussions of research and health care. The mission of the Children's Cause is to help kids with cancer live longer, healthier lives. We work to achieve access to less toxic but more effective cancer treatments, to expand resources for research and specialized care, and to address the unique needs and challenges of childhood cancer survivors and their families. The Children's Cause is focused on how improving the conduct of research can improve treatment and care for our children. We are working to reverse budget cuts to critical research funding. We work on healthcare and reimbursement legislation with direct implications for our kids and families. And we stay closely engaged with legislators throughout the process, from advising and drafting policy to guiding the implementation of specific provisions long after a bill has been enacted. Our objective is to ensure that children with cancer are considered in every discussion that may affect quality care and treatment. Since our founding, progress has been made, but it is not nearly enough. Cancer still claims the lives of 1 in 5 American children diagnosed. To succeed, we need more advocates and more resources. Through decades of experience from our board, advisors, and staff, the Children's Cause has built a reputation of responsible leadership that has made us the go-to childhood cancer resource for policymakers in Washington. We offer thoughtful and independent analysis of complex issues through our policy briefs, workshops, and newsletters. By bringing together informed advocates from every part of the childhood cancer world, we are changing the landscape bit by bit. We have cultivated relationships with leaders in pediatric oncology, research, Congress, federal agencies, and the media. Our collaboration with strategic partners and our leadership of coalitions place us in a unique position to drive progress for our children and families. The Children's Cause harnesses the passion of survivors and families, empowering them to be effective childhood cancer advocates. We make the challenges facing children with cancer concrete for federal policymakers. The faces and stories of children and parents have a powerful influence when brought into a congressional office. I can attest from my son William's experience, it leaves a lasting feeling of empowerment with survivors and families. The Children's Cause takes this approach one step further by providing advocacy training through our program called Translating Our Voices into Action. These newly trained advocates return to their home states and local organizations with honed tools to meet their community's specific needs. This strategy amplifies our impact and spreads a thoughtful and effective outreach beyond our Washington policy work. The ultimate measure of success for the Children's Cause comes through important, though incremental, changes in how the federal government addresses the needs of children with cancer. We measure our impact in part by tracking inquiries for information and analysis that we receive from congressional staff, researchers, families, and advocates. We have seen considerable increases in the size and scope of our online network and website traffic. By leveraging social media, we are able to extend our reach to educate and mobilize increasingly more advocates on behalf of children with cancer. In our first year of launching online action alerts, we saw a 25% increase in our network. The Children's Cause is different from other childhood cancer organizations because our area of expertise is federal policy. Because of the unique nature of the childhood cancers, and because they are less common than adult cancers, most childhood cancer research is either funded by the government or it is not funded at all. Federally funded clinical trials are a lifeline for the majority of children with cancer. Our guiding principle is ensuring that all children with cancer and survivors have access to the critical treatments and follow-up care they need, regardless of income, location, or insurance status. We focus on creating better policies and regulations because we know that's the key to a better future for our kids. The programs of the Children's Cause have educated and empowered hundreds of survivors and have trained dozens of community leaders as advocates. The imprint of our policy work can be found on major federal laws impacting the development of less toxic treatments, funding for research and care, and addressing the unique needs of survivors. For instance, there was a recent crisis where hospitals were faced with a shortage of life-saving chemotherapy drugs used to treat children with leukemia. The Children's Cause worked with other groups to restore the availability of those drugs and to put laws in place that will help prevent future shortages. The Children's Cause has a small staff doing big things. Unlike many other advocacy organizations, we don't have resources for a development director or a dedicated communications director. These staffing limits restrict our ability to find new funding opportunities to grow our programs and let more people know about our work. Diversifying our sources of funding would give the Children's Cause the ability to build on our progress and make greater strides for our kids. More resources would allow the Children's Cause to expand the breadth and depth of our important policy work. One more staff member working on these issues would mean the opportunity to educate and train more advocates to spread the word about research and healthcare needs. It would mean we could write and disseminate more materials about complex issues, meet with more high-level decision makers, and create more national awareness of childhood cancer issues. To reach the goal of curing all children with cancer and preventing dangerous late effects, the Children's Cause must continue to press for healthcare reform, not just on the federal level, where we are currently active, but on the state level too. Policy and funding issues can vary widely from state to state, so our message must also reach state and local decision makers. More trained, state-based advocates could have a major impact on ensuring the highest quality care and treatments for all childhood cancer patients and survivors.